Brain cancer, a topic that strikes fear into the hearts of many. But what causes this devastating disease? Let's dive into the intricate world of brain cancer and explore its origins. First and foremost, genetic factors play a significant role in the development of brain cancer. Mutations in certain genes can increase the risk of developing this condition. These genetic abnormalities can be inherited or acquired over time due to various environmental factors. Exposure to ionizing radiation is another known cause of brain cancer. Whether it's from medical treatments like radiation therapy or environmental sources such as nuclear fallout, prolonged exposure to ionizing radiation can damage the DNA in our cells, potentially leading to cancerous growths in the brain. Furthermore, certain chemicals and toxins have been linked to an increased risk of developing brain cancer. Substances like formaldehyde, pesticides, and industrial chemicals have been identified as potential carcinogens that can penetrate the blood-brain barrier and wreak havoc on our brain cells. Moreover, viruses such as the Epstein-Barr virus and cytomegalovirus have been associated with an elevated risk of brain cancer. These viruses can infect brain cells, causing inflammation and genetic mutations that may trigger the development of tumors. Lastly, age and gender also play a role in the incidence of brain cancer. As we age, our cells become more susceptible to mutations that can lead to cancer. Additionally, men are more likely to develop brain cancer than women, though the reasons for this gender disparity are still being studied. In conclusion, brain cancer is a complex disease with multiple potential causes, including genetic predisposition, environmental factors, radiation exposure, chemical toxins, viral infections, and demographic variables. By understanding these underlying factors, we can work towards better prevention, early detection, and treatment strategies to combat this formidable foe.
So, you want to know how to prevent brain cancer? Well, let me tell you, it's all about taking care of your noggin. First things first, let's talk about lifestyle choices. Eating a healthy diet rich in fruits, vegetables, and whole grains can do wonders for your brain health. And don't forget to stay active. Regular exercise not only keeps your body in shape, but also helps reduce your risk of developing cancer. Next up, let's address those bad habits. Smoking and excessive alcohol consumption are not your brain's best friends. If you want to lower your risk of brain cancer, it's time to kick these habits to the curb. Trust me, your brain will thank you. Now, let's talk about protection. When you're out and about, make sure to wear a helmet during activities like biking or skating. It may seem simple, but protecting your head from injury can go a long way in preventing brain cancer down the road. And last but not least, let's not forget about regular checkups. Visiting your healthcare provider for routine screenings can help catch any potential issues early on. Early detection is key when it comes to fighting cancer, so don't skip those appointments. Remember, your brain is a precious organ, so treat it with care. By making smart lifestyle choices, protecting your head, and staying on top of your health, you can significantly reduce your risk of developing brain cancer. So, let's take charge of our health and keep those brains in top shape. I remember the day I first noticed something wasn't quite right. It started with persistent headaches that just wouldn't go away, no matter how much I rested or took painkillers. At first, I brushed it off as stress or lack of sleep, but deep down, I knew something more serious might be going on. As days turned into weeks, I began experiencing unexplained seizures, sudden changes in my vision, and difficulty with my balance and coordination. Tasks that used to be second nature became challenging, and I found myself struggling to concentrate and remember things. I knew I couldn't ignore these signs any longer. That's when I decided to seek medical help. After a series of tests and scans, the diagnosis came back: brain cancer. It was a shock, but catching it early meant I had a fighting chance. Early detection is crucial when it comes to brain cancer. Knowing the signs and symptoms can make all the difference. Look out for persistent headaches that worsen over time, unexplained seizures, changes in vision or hearing, difficulty with balance and coordination, and cognitive changes like memory loss or confusion. If you or a loved one experience any of these symptoms, don't wait. Seek medical attention immediately. Remember, early detection saves lives. don't ignore the signs. Your health is worth fighting for. I'm grateful I listened to my body and took action when I did. Today, I'm undergoing treatment and fighting this battle head-on. It's not easy, but I'm determined to beat this. And I want you to know that you're not alone. Together, we can raise awareness, support each other, and make a difference in the fight against brain cancer. Stay vigilant, stay informed, and remember, early detection is key. Let's stand strong and fight for a brighter, healthier future. Living with brain cancer can be a daunting journey, but there is hope. Today, I want to talk about effective treatments that are making a difference in the fight against this challenging disease. One of the most common treatments for brain cancer is surgery. Surgeons work tirelessly to remove as much of the tumor as possible while preserving healthy brain tissue. This procedure can help alleviate symptoms and improve the patient's quality of life. In addition to surgery, radiation therapy is often used to target and destroy cancer cells. This treatment uses high-energy rays to shrink tumors and prevent them from growing. It can be a powerful tool in combating brain cancer and increasing survival rates. Chemotherapy is another vital component of treatment for brain cancer. This systemic therapy uses drugs to kill cancer cells throughout the body, including those that may have spread from the original tumor. Chemotherapy can be administered orally or intravenously and is often used in combination with other treatments for maximum effectiveness. Immunotherapy is a promising new approach to treating brain cancer. This innovative treatment harnesses the power of the body's immune system to target and destroy cancer cells. By boosting the immune response, immunotherapy can help the body fight off cancer more effectively. Clinical trials are also crucial in the search for new and improved treatments for brain cancer. These studies test the safety and effectiveness of new therapies, giving patients access to cutting-edge treatments that may not be available elsewhere. Participating in clinical trials can help advance research and improve outcomes for future patients. It's essential for patients to work closely with their healthcare team to determine the best treatment plan for their specific situation. By staying informed, asking questions, and exploring all available options, patients can take an active role in their care and increase their chances of successful treatment. While living with brain cancer is undoubtedly challenging, there are effective treatments available that offer hope and the possibility of a brighter future. By staying informed, seeking support, and working closely with healthcare professionals, patients can navigate this journey with strength and resilience. Living with brain cancer is a tough journey, but post-treatment care is crucial for your recovery. As a brain cancer survivor myself, I understand the challenges you may face. Here are some essential tips to help you navigate this phase. First and foremost, follow your healthcare provider's instructions diligently. Attend all follow-up appointments, take medications as prescribed, and communicate any new symptoms promptly. Your medical team is here to support you every step of the way. Maintaining a healthy lifestyle is key. Focus on a balanced diet rich in fruits, vegetables, whole grains, and lean proteins. Stay hydrated and limit processed foods and sugary drinks. Regular exercise, even light activities like walking or yoga, can improve your overall well-being. Managing side effects is crucial. Whether it's fatigue, cognitive changes, or emotional distress, don't hesitate to seek help. Support groups, counseling, or therapy can provide valuable emotional support during this challenging time. Cognitive rehabilitation can help you regain mental function. Engage in brain-stimulating activities like puzzles, reading, or learning new skills. Stay mentally active to enhance your cognitive abilities and memory. Prioritize your mental health. Practice relaxation techniques such as deep breathing, meditation, or mindfulness to reduce stress and anxiety. Surround yourself with a strong support system of family and friends who uplift and encourage you. Lastly, don't forget to take care of yourself holistically. Find moments of joy in simple pleasures, pursue hobbies you love, and stay connected with your passions. Remember, you are more than your diagnosis. By following these tips and staying proactive in your post-treatment care, you can enhance your quality of life and promote your recovery journey. Stay strong, stay positive, and know that you are not alone in this fight against brain cancer.